module, we will discuss what is mental health. The World Health Organization defines mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, and can work productively and fruitfully, and is able to make contributions to his or her community. Based on this definition, mental health can be understood as an integral component of health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world that we live in. Mental health is crucial to the development and well-being of individuals as well as societies, and it is a basic human right. We understand mental health as a human experience and something that lies on the continuum from good mental health to psychosocial disability. Without prevention and early intervention mechanisms or adequate support services, mental health problems can worsen over time. While there might be the misconception that some people are destined to experience mental health problems due to biological or weak personality, the reality is that a person's mental health can be influenced by a variety of factors that go beyond personal traits and genetic predispositions. For example, life events, socio-economic conditions, environment, and climate concerns. These are just a few examples of what can impact the mental well-being of every person. An incident that showed extensively the variety of factors that can negatively impact the mental well-being of people was the COVID-19 pandemic. Virtually everyone experienced some sort of mental distress between 2020 and 2021, with some data suggesting that experiences of anxiety and depression have increased by 25% globally, while some other evidence suggesting that these might be even doubled. As mental health means having a level of well-being that enables a person to contribute to their community, poor mental health and its risk factors also have an impact on the overall well-being and economy of societies. For instance, the World Economic Forum projects cumulative costs of low productivity due to psychological distress and suicide during the period 2020 and 2025 at 114 billion, including 11 billion in lost productivity amongst young people. Given the human and economic costs that poor mental health can cause, there are arguments to address mental health risk factors for the health and well-being of both people and societies. Our experiences are diverse, and this should be reflected in the solutions provided in order to help us move away from practices and approaches based on discrimination and towards inclusion. In the next module, you will explore what the UNCRPD is and how this convention connects to the psychosocial approach to mental health.